The neurologist I saw, he gave up after about 3 months with me. He ran some EMGs, and I went to an orthopedic surgeon. He said that he'd probably have to fuse at least 5 levels in my low back with rods and screws. That didn't count getting rid of the pain. That was just me being able to move around. And I went to a neurosurgeon. He offered laminectomy, where they scraped the bone around off some of the sites to give my nerves more space. It wasn't the nerves, it was this that was leaking. I went to see a second orthopedic surgeon. He would just take out the 2 torn discs and replace them, put a basket in my back, fill that with bone and some other tissues, and make a new disc for me. That would fuse the bottom 2 vertebrae. That wasn't going to help the ones that were still moving in and out where the discs were being impinged, so it would mean more surgery after that. Or they could put a neurostimulator in me, see if they could trick my brain into not perceiving the pain. Everybody I've seen so far could only offer a minimum of 50% success rate to help out. That makes no sense to me at all, to go through that with at least a 9 months to a year's recovery and having rods and screws that could possibly come loose, and I'd have to have more surgery on top of that. I've had 3 neck surgeries. I use that to compare what they're telling me about having these back surgeries. With a neck surgery, they put me in a solid neck brace for 3 months. While that fuses together, it limited the motion in my neck. So I have maybe 30% range of motion. I came to see my pain management doctor, Miller. He kept encouraging me, saying, we're going to find something. So he gave me a lot of literature, and he says, I really think you need to try the stem cells. Couldn't hurt me. It could only help me. Didn't have long recovery times. And so I tried it. Was just excited with the results. I mean, it was amazing. Like as it was a miracle. I'm so glad I did it. It just made such a difference.